My name is Donna McCuller, and today I want to discuss with you asthma. And if you or anyone you know may be at risk or even suffering from this condition, how to manage um, and properly treat, as well as knowing the complications of asthma. Have you ever gone for a walk or a jog and all of a sudden a cough spell comes upon you and you can't catch your breath? Well, I know exactly what that feels like, because I suffer from asthma and I have been since 2009. And so does 25 million Americans, according to the Asthma, Allergy, and Immunology Academy. Asthma is a chronic condition and potentially deadly disease that affects the airways in the lungs. These airways, or bronchial tubes, allow the air to come in and out of the lungs. When these airways become restricted, this can cause difficulty breathing, wheezing, coughing, and medication is often needed to relieve these symptoms. This is why it is important that everyone knows the risk factors, how to manage, and the possible complications of asthma. With knowing this information, you can save yourself or someone you love. Now, everyone should know their risk factors. This means that this means how a person typically can get the disease, or just being able to identify and help with identifying the signs and symptoms. Now, most people who develop asthma develop it because of family history. If you have a history of developing asthma, or family, I'm sorry, if you have a family history of asthma, then you are more likely prone to develop it yourself. Another form of asthma is allergic asthma. This form of asthma is due to a person who has an allergy, and this could be any type of allergy, and this can increase your risk for developing asthma as well. Another form of asthma is occupational asthma. This asthma typically happens to adults who are working in certain type of work environments that have or that they're working around chemicals, dust, um, or any type of thing that can be inhaled into the lungs that cause irritation and restriction of the airways. Most common form of asthma is childhood asthma, and this is something that is developed by children, typically at a very young age. These symptoms do typically subside as the child gets older, and they experience these symptoms less frequently. Now that you know the different forms of asthma and the risk factors that they carry, now let's look into the management of asthma. Every everyone should know that there is no cure for asthma, but you can treat the disease by controlling your symptoms and properly treating it with the correct medication. There are a couple of different medications that you can take in the possible prevention of excavations or asthma attacks, as well as preventing the symptoms altogether. The first thing that I'm going to discuss is the inhaled steroid. The inhaled steroid can be taken on a daily basis, and this helps and aids in the prevention of um, asthma attacks, which is, like I said before, the restriction of the airways. An example of this drug is Advair Discus. This is something that I have to take personally twice a day to prevent asthma symptoms. Now, if a person is still having difficulty breathing, like I said before, even with a walk or a jog, and they are having difficulty breathing and they need to have a rescue inhaler. A rescue inhaler is something that helps immediately once it is inhaled into the lungs with opening up the airways. This here is albuterol, F8, HFA. This is something that I use as well as a rescue inhaler to help me when I am having a severe onset of those symptoms with the difficulty of breathing. Now, sometimes that medication does not help, and I actually need to go and see a medical provider to get something a little bit stronger in relieving my symptoms and opening up the airway. This sometimes this is caused for me to have an oral corticosteroid, which is um, a drug similar to this, but you're taking it in a pill form. And the drug that's typically prescribed is called prednisone. Prednisone is something that is given to adults, but in children, they give Orpred. And this drug helps with the opening of the airways. Now, the last thing that I want to discuss in the management is having an action management plan. An action management plan is something that everyone with asthma should have in place. So when you have it where you have gone through all the steps of taking the different medications such as the inhaled corticosteroid, such as the Avirodiscus, or your rescue inhaler, such as albuterol, and if this doesn't aid or relieve any of your symptoms, what are your next steps going to be? This is something that is very important for every asthma sufferer. You need to know what are your next steps to prevent it from being potentially fatal. And the next steps will be definitely getting to a medical provider and getting drugs such as the inhaled corticosteroid, prednisone. Now, when a person fails to keep their asthma managed and they run into a problem of creating complications such as infections, and some of these infections are influenza, which affects the nose, throat, and lungs, as well as pneumonia, which is a fluid buildup within the lungs. Having both of these infections can be potentially fatal for asthma or any person with any type of respiratory disease. It can be fatal, and they have to get to a provider right away. Proper treatment can make a difference in preventing both short-term and long-term complications caused by asthma. Although most people are able to effectively control their asthma symptoms, which can be life-threatening, often some people die from asthma at home because they do not recognize their condition is getting worse, or they leave it too long without taking action. Do not let this happen to you or anyone that you love. Take action. Properly prevent this from happening to you by managing your symptoms and knowing when you're in trouble or when your family member is in trouble. This is why it's important to manage your asthma, knowing the risk factors as well as the possible complications. If a person gets the proper treatment and have their asthma management plan in place, they will be able to minimize their symptoms and have a better quality of life. I hope this helped you today because it's helped me. Thank you and have a great day.